He spent over $100,000 trying to fix chronic prostatitis and went to over 20 doctors, yet nothing worked. Imagine dealing with constant lower urinary tract pain, inability to have sex, urinating all over yourself, and the depression that comes with it. Many guys are driven to suicide because of this issue, and modern medicine seems to have no cure. But in this video, I'm going to show you how we do the impossible and cure it for our clients with absolutely zero side effects. This is important because it can save you from the pain, the suicide, or prostate surgery, and I'm going to show you the scientific proof driving everything that we do. This is game-changing and life-changing, and people need to know about this, so we're not going to hold anything back. But before we dive in, I want to address something that's very important. This is something traditional medicine would have you believe is impossible, as most medical doctors don't research shit, and just follow what they're taught in institutions, who are working in concert with the pharmaceutical industrial complex. But the reality is, the medical system is failing people who are dealing with issues like chronic prostatitis, and we have to go beyond mainstream methods and outdated science. So let's dive in. Chronic non-bacterial prostatitis or benign prostatic hyperplasia can be hell for people who have it, because they're facing with constant pain, inability or reduced ability to ejaculate so they can't have sex, uncontrollable urination, feelings of incomplete bladder emptying, and urgency. And these are just some of the symptoms that can wear on people mentally, and they often suffer from depression, poor mood, which can sabotage relationships with friends, not just their significant other due to an inability to perform sexually. Now, the mainstream offers almost no hope to these people. Now, this enlargement of the prostate, coupled with changes in the collagen around the urethra and increased urethral length, results in increased urinary resistance and obstruction. A healthy weight of the prostate is about 20 grams, but even minor BPH is classified as 30 grams, and this is where minor symptoms start to develop. So it really doesn't take much, and once it reaches 50 grams, you're looking at an increased risk of acute urinary retention, and if this happens, surgery would be needed to remove the prostate, and then you lose the ability to ejaculate. And you may even need a penile implant just to achieve erection again. Now, the Forth Valley study in Scotland found that 14% of men aged 40 to 50 years old have BPH, and that increases to 43% among men older than 60. BPH has also been shown to be nearly as prevalent as hypertension and diabetes among patients who are seeking treatment for erectile dysfunction. So it's one of the leading causes, and know it if this is the cause in the early stages, as you may not have much of an obstruction, but just have a reduced sexual drive, which you may think is coming from a hormonal imbalance, leading you down a path of trying to correct symptoms, but going the entirely wrong direction. Now, traditional treatments for benign prostatic hyperplasia often focus on alpha blockers, such as temsulfazocin or alfazocin, which can help to relax the smooth muscles in the prostate and bladder and help to accelerate the urine stream. Or tadalafil, which works similarly, albeit through a different mechanism, which I made the most detailed video of on the entire internet, by the way. And in extreme cases, 5-alpha reductase inhibitors like finasteride or dutasteride are used. However, these last ones work by reducing the conversion of testosterone into a more androgenic hormone known as DHT. And this can cause side effects, such as reduced sense of masculinity, worsened mental state due to disruptions in the neurosteroid pathways, and decreased insulin sensitivity, which could contribute to diabetes. Now, they are effective at slowing prostate growth from androgen sensitivity and treating certain types of hair loss like androgenic alopecia, but the side effects can be concerning, and the results are still not as good as what I'm going to cover in this video. One of our clients had been using alfazocin, an alpha blocker, and tadalafil, and he experienced some relief, but it wasn't enough. After starting Prostatilen combined with our other synergistic peptide strategies, he saw a complete resolution of all symptoms, as if the problem had never even existed. Prostatilen contains peptides from the animal prostate tissue, and it's been shown in the literature to perform the impossible, by healing conditions deemed incurable. Now, despite these proven results, these peptides remain underutilized and not widely known. Some people dealing with chronic prostatitis fail to get relief from traditional medical treatments, even after going to a urologist who specializes in these types of disorders. Recommendations such as prostatic massage, whether internal with a vibrator or external through high-powered shockwave therapy, often fail to provide adequate relief. And on YouTube, you could find numerous accounts of people enduring prostatitis for years, and the rate of suicide among those with prostatitis is 1.58 times higher compared to those without the condition. So in this video, I'm going to show you how Prostatilen is not just superior to 5-alpha reductase inhibitors and alpha blockers, but how it also has absolutely zero side effects. This is important because it can save you from the pain, the suicide, or prostate surgery, which results in nerve damage and in a high number of cases, men being unable to ever get an erection again without an implant, and also suffering urinary incontinence. While pelvic floor exercises can help if you're at that stage and are things I recommend in general for male health, it would be much better that you avoid ending up in such a dire situation in the first place. So Prostatilen improves blood flow to the prostate, bladder, and the kidneys, and it has a profound anti-inflammatory effect. It's been shown to reduce protein levels in the urine and phosphatase activity, and it also reduces CRP in the blood serum. Now, in cases of benign prostatic hyperplasia, it decreases prostate weight, improves urination and erectile function, and it's been shown to be more effective than 5-alpha reductase inhibitors and alpha blockers at improving symptoms. And it works long-term, too, through reducing the actual size of the prostate. That's right, something traditional medicine would have you believe is impossible. Unfortunately, many doctors don't research beyond what they're taught in institutions that often align with the pharmaceutical industrial complex. Prostatilen also demonstrated a 32.5% increase in sperm concentration per milliliter of ejaculate, and it improves sperm motility by up to 62% in the long term. And it decreased the anti-sperm antibodies, reactive oxygen species, and leukocytes in the ejaculate. Testosterone levels and erectile function improved, and the catecholamines increased in the testes. Now, this can boost your fertility and hormones. Now, on top of that, Prostatilen reduces blood serum triglyceride levels, uric acid, and platelet aggregation, while boosting immune function by increasing the CD4 count, which can even be beneficial in cases of infection in theory. Now, these benefits are truly extraordinary and can quickly give men their lives back after suffering from this debilitating condition for so long. But that's only if they're used correctly. And in my Peptide Mastery course, I cover the best route of administration, dosing, and how to stack Prostatilen with synergistic peptides for even more effective results. This is important because if left untreated, it could potentially lead to prostate cancer, which is the second leading cause of cancer death in American men. Now, while it's rarely diagnosed before the age of 40, lesions can begin to develop as early as the age of 30, and a rapid increase in tumor weight can occur thereafter. And that raises the risk of prostate cancer later in life. So it makes preventative treatment with Prostatilen a smart idea. Now I want to briefly touch on another major cause of prostatitis, which is chronic bacterial infection. This is notoriously difficult to treat because antibiotics often struggle to penetrate the prostate. And there are these superbugs which are becoming more prevalent, and these can form these protective biofilms which shield them from antibiotics. And it's even worsened by quorum sensing, which is when these bacteria communicate through signaling molecules to coordinate defenses against antibiotics. Fortunately, there are strategies to disrupt this quorum sensing and improve antibiotic effectiveness, but they must be used in combination with the right antibiotics for each specific case. Now, immune health also plays a critical role in the success of these treatments because if you don't have a strong immune system, antibiotics just don't work as effectively. Thankfully, we have solutions to boost immune function and improve treatment outcomes as well. Now, all of these protocols are thoroughly covered in my Peptide Mastery course, and we also offer personalized coaching through our molecular bioenhancement coaching programs.